I just want to say hello and welcome to the Healthy Living series in partnership with Confluence Health. I am Alicia, I'm the Adult Services Manager here at NCW Libraries. And thank you so much for joining us. Our mission here at NCW Libraries is to connect the people of North Central Washington to vital resources and opportunities that foster individual growth and strengthen communities. So just by being here this evening, you're helping us fulfill our mission. So this evening, our presentation is Don't Take My Breath Away, Preventions and Screenings for Lung Cancer. It's facilitated by Dr. Saba Lodhi, and she is the Medical Director of the Intensive Care Unit at Confluence Health, Physician Manager for the Department of Pulmonary and Critical Care of Medicine at Confluence Health, and a Clinical Assistant Professor at the University of Washington.
Thank you so much. I want to thank everybody who is taking time out of their evening and joining this talk on a very important topic. So what I'm hoping to accomplish in the next 40 minutes or so, leaving some time in the end for questions, is that we will talk about the impact of lung cancer. Why is it important? Why are we here today talking about this topic? And then focus really most of the talk on the risk factors for lung cancer. What are the risk factors, and are there things we can do to mitigate those risks? What can we do to minimize those risks? We will talk about the symptoms and then finish off with the role of screening for lung cancer, which is a newer concept as opposed to screenings for other kinds of lung cancer. So moving forward, why do we worry? Why lung cancer? What is the impact of lung cancer? So if you look at the slide on the right, it shows the data from the American Cancer Society from 2021. And it shows the estimated new cancer cases in the United States, separated by gender. And you can see on the left with the men and on the right with the women, lung cancer is the second most common cause of cancers in the United States. And it was only replaced by breast cancer in 2020. So up until 2020, lung cancer was the leading cause of lung cancer in women and the second most common cause in men. So that impact is huge. Look at this impact though. So again, the data on the top is what we already talked about, that lung cancer is the second most common cause right now based on the newest 2021 data. But the bottom part of the slide, it shows us the estimated number of deaths from all cancers in the United States in 2021. And you can see that despite being the second most common cause of cancer, it remains the leading cause of cancer-related death in both men and women. This is another way of looking at it. If you take the three next most common causes of cancer in the United States together, right, which is colon, breast, and prostate, lung cancer takes more lives annually in the United States than the next three most common cancers combined. What does that look like? Lung cancer kills about 2.5 times as many men as prostate cancer and 1.5 times as many women as breast cancer. So that's huge. The cancer risk of mortality, risk of dying from lung cancer is extremely high. More data points for why we attach so much importance to this. 1 in 15 Americans will be diagnosed with lung cancer at some point in their lifetime. Every 2 to 3 minutes, someone is diagnosed with lung cancer. And then not only that, not only the frequency of how common this cancer is, but look at the slide on the bottom right. 391 Americans will die of lung cancer today. That's more than what will fit on a full Airbus A340. And yet, lung cancer has the lowest 5-year survival rate. So again, this slide shows the three most common cancers which follow lung cancer, which is colon, breast, and prostate. And if you look at the survival rates, on an average, only about 2 out of 10 people who are diagnosed with lung cancer will survive a total of 5 years, as opposed to a much better survival rate with the other cancers. The question then is, what can we do? Right? I think we all get the fact that the cancer is common and the cancer is extremely lethal. So what can we do? What are the risk factors, and can we do things to minimize the risk factors? These are the most common causes of, or the most common risk factors for lung cancer listed on the slide there. Cigarette smoking is number 1, and that is followed by exposure to radon, exposure to asbestos, passive smoke exposure, genetics, presence of other lung diseases that can damage the lung tissue, and a history of prior radiation to the chest. And what we will do is, over the next several minutes, we will take the important risk factors from these and talk about their impact, and then what can we do? Are there measures we can take to minimize those risk factors? So let's start with smoking, because smoking remains the leading cause of lung cancer worldwide. about 90% of total lung cancer cases are actually caused by smoking. How can smoking cause cancer? So what happens is that when you smoke cigarettes, the cigarette smoke releases over 5,000 different chemicals. These harmful chemicals enter our bloodstream, and they can affect not only the lungs, but the entire body. These chemicals damage our DNA, including key parts that protect against cancer. Not only that, they also interfere with how the cells in our body repair the damage to the DNA. And the net effect, the combined effect of both of these things is that the DNA malfunctions, the cells don't know when to stop multiplying, they overgrow, and that's what manifests as cancer in the body. So what is in tobacco smoke? Why is it so bad? This is only a small list of all the harmful compounds that are found in tobacco smoke. Tobacco smoke has thousands of chemicals, and at least 70 of those have been identified as cancer causing. And most of these substances actually come from the burning of tobacco leaves themselves, not from other additives that are added into the tobacco products. You will see some radioactive elements listed on there, such as polonium. And these elements come through the fertilizer in the soil that's used to grow the tobacco leaves. So the amount that's found in the cigarettes you're smoking, it depends on the soil the plants were grown in. That is an extremely hard thing to regulate. So really, we don't know what the net exposure of those radioactive elements is. So then what about cigars? You know, people say, okay, yes, we've heard about cigarettes, so we switch to cigars. Are cigars any safer? So cigars actually contain many of the same compounds as cigarette smoke, but some are present at different concentrations. And actually the aging process that is used to make cigars, it leads to high concentrations of some of the nitrogen compounds. You know, the science is nitrates, nitrites, which gives off several of these compounds called TSNAs, or tobacco-specific nitrosamines, which are some of the most potent, one of the most strongest cancer-causing substances known to mankind. What's even worse is that the cigar wrapper is less porous than a cigarette wrapper, so the tobacco doesn't burn as completely, and that can result in a significantly higher concentration of nitrogen oxides, ammonia, carbon monoxide, and tar, substances that have been shown to have not only increased risk of lung cancer, but several other harmful effects to human health. The next natural question is, well, what about chewing tobacco? Fine, I'm not going to smoke anything, but can I switch to chew? So people who dip or chew, the first thing to remember is that, one, they're exposed to the same amount of nicotine as people who smoke regularly. So the addictive properties of chewing tobacco are just as bad as smoking a cigarette or cigar. They're also exposed to more than 25 chemicals that are known to cause cancer, the most harmful of which is, again, the tobacco-specific nitrosamines, or TSNAs. Now, the important differentiation is that chewing tobacco does increase risk of lung cancer, but it's most commonly associated with the higher risk of developing oral cavity cancer, or cancer of the mouth, of the throat, of the voice box, and of the food pipe or the esophagus. A lot of people are using e-cigarettes as a means to help them quit smoking. Another important thing is that most contain nicotine, even when claiming to be nicotine-free. A common misconception is that because of the term vaping, that the aerosol that comes out of an e-cigarette is not, is water vapor, and it's actually not. It's an aerosol that contains a lot of harmful compounds, including the substances that are used to produce stage fog, and they can be extremely irritating to the lungs. It also contains formaldehyde, which has been known to cause cancer. And what's worse is that we don't know what's in the flavoring chemicals. Diacetyl was one of the flavoring chemicals that was linked to the fatal lung disease that became very rampant in 2019, resulted in deaths of many young people with a non-reversible damage to the lungs. The FDA also does not regulate all of the substances in e-cigarettes, so it's very hard to know exactly what chemicals are in it. And some products are labeled incorrectly. So while the disclaimer is that we do not yet know if e-cigarettes are linked to a higher risk of lung cancer, we don't know what the long-term effects would be. The best way to look at e-cigarettes is to look at when cigarettes were first introduced, and we did not know that they were going to be associated with a higher risk of chronic lung diseases and several cancers. We just don't have much long-term data because of how new these are to know if they really increase the risk of lung cancer or not. What can we do to minimize the risk of lung cancer? So number one cause of lung cancer. So if you do smoke, if you have a loved one who smokes, best thing to do is quit smoking. There's no way around it. No substitutes. You have to quit smoking. As hard as it sounds, has a number of beneficial effects. The short-term effects are, on one hand, if you look at the long-term effects, at 1 year, your risk of heart disease is half that of a smoker. Give it about 5 years, and your risk of stroke decreases to that of a non-smoker. And the risk of mouth, throat, and food pipe and bladder cancer becomes that half of a smoker. In about 10 years is when your risk of lung cancer becomes half that of a smoker. You also reduce risk of pancreatic and throat or voice box cancers. And in about 15 years, your risk of heart disease becomes the same as a person who's never smoked in their life. So lots of benefits from quitting smoking. So is that enough if you quit smoking, which is an extremely hard thing to do? But once you quit smoking, it is as important to avoid secondhand smoke. The pictures on the left are pictures taken from lungs of 3 different individuals labeled A, B, and C. The picture A is from a person who's never smoked. It's a non-smoker. The person to the extreme right, the person C, is somebody who's an active smoker. And right smack in the middle is a person who's only exposed to passive smoke. The areas in yellow indicate the amount of inflammation in the lungs. And you can see that a passive smoker, a person who is not actively smoking, still has a significant amount of inflammation in the lung. Secondhand smoke has been associated with more than 7,000 deaths from lung cancer and more than 30,000 deaths from heart disease every year. What's worse is that patients with non-small cell lung cancer, which is the most common type of lung cancer, who continue to be exposed to secondhand smoke tend to have worse outcomes from their disease, despite quitting smoking and despite ongoing treatment. Well, what if you don't smoke? People are like, well, am I good then? Unfortunately, no. While most of the lung cancer is seen in smokers, 61% of it is seen in former smokers, people who have quit smoking. 21% is seen in people who are currently smoking, but almost about 18% is seen in people who've never smoked in their lives. Another way of looking at those numbers is about 25,000 people in the United States get lung cancer each year despite never smoking in their lives. So why is that? Are there other risk factors that are important? And the answer is yes. The second most common cause in smokers of lung cancer is exposure to a radioactive gas called radon. It is the #1 cause of cancer in non-smokers. Radon is a radioactive gas that is caused by natural breakdown of uranium and radium in the soil. It is completely odorless. You cannot smell it. It's tasteless, and you cannot see it. So it is extremely dangerous. How do you get exposed to radon, right? So radon is actually produced in the soil and normally enters our homes through cracks and through pipe fittings, less commonly through wells, which are not as common in these days, mostly through cracks in the houses. The Environmental Protection Agency, the EPA, estimates that 1 of 15 homes in the United States has high radon levels, which are dangerous levels of radons. So how does radon cause lung cancer? When you inhale radon, or the decay products of radon, the alpha particle, which is a radioactive particle, it attaches to the DNA and it causes radiation damage to the DNA. So the DNA stops sending signals to the cells when to stop multiplying. The cells continue to multiply at a much higher rate, and that's what manifests as cancer. I put this slide on here because this is an Environmental Protection Agency or EPA map of the radon zones across the United States. The bright red or the zone 1s are the highest radon producing geological areas, and zone 3, which is where we are the lowest radon producing areas. But the reason why I put this map up there is that it's actually being in a low zone does not mean that you shouldn't test your home radon levels. Testing home radon levels is highly recommended because of how strong the association with lung cancer is. So how do you test home radon levels? There are testing kits that are available. They're available online and at home improvement stores and hardware stores like Lowe's and Home Depot. There are 2 general ways of testing radon, short-term and long-term. And as the name implies, the short-term testing is the quickest way to test. And the collection device is a much cheaper device than the long-term testing devices. It's a charcoal canister system typically that remains in your home for anywhere from 2 to 90 days. So radon levels in our homes can vary from day to day and from season to season. So a short-term test is not likely to produce a very reliable year-round average. However, the EPA, the Environmental Protection Agency, it recommends the testing steps as follows: that you first take a short-term test, and if your results are high, and we'll talk about what the high levels are, then you take a follow-up test just to be sure. And the follow-up test can be a short-term test if you're in a hurry, but better would be if you follow up with a long-term test that remains in your home for more than 90 days and gets a good average. A limited number of these testing kits can be available for free from the Department of Health, and they're available in different languages. I listed the numbers on this slide, the numbers you can call, or if you go to their website, there's an email you can send through the website, and they will mail you the kits with instructions and a prepaid envelope that you can then mail the canisters back to them, and then they'll mail you the results back. If you don't want to do any of that work, you can also hire a professional radon tester, although most of these professionals are hired when radon detection is part of a real estate transaction. I did a quick Google search and found that we do indeed have radon testing contractors in Wenatchee. I listed one of the numbers there in the slide on the left. The second picture on the right is a picture I got off the site from Home Depot, which shows the carbon canister type radon testing kit, which is priced at around $48. And then this kit comes with instructions to use and a data sheet where you can put down what it showed, a prepaid return mailer, and then a prepaid report of the lab analysis. The monitor on the right, which is a little more, quite more expensive, is more like a carbon monoxide monitor. So that's more of an ongoing monitor that you can leave in the house that can alert you if the radon levels are getting high inside the house. On Amazon, if you look at the prices, the short-term testing kits, they range anywhere from $14 to $30. So a relatively inexpensive test that can give you a much better understanding of your risk based on the radon levels inside your house. So understanding radon levels, what is a high radon level? The EPA recommends fixing your home, and we'll talk about how, if the radon level is above 4 picocuries per liter. That's the unit where they measure the radon levels. What does 4 picocuries look like? So if your radon levels are around that recommended level where you need to fix something, that's the equivalent of you smoking 8 cigarettes per day or getting 200 chest x-rays per year. So that's a lot of, in other words, that's how much risk, increased risk of lung cancer it confers if the levels are that high. The United States Environmental Protection Agency recommends a level of 4 as the actionable level, that this is where you should take action. However, the World Health Organization, its levels are, the actionable levels are a little bit lower. They're around 2.7. The general consensus is to intervene between 2 and 4. The little blurb on the right talks about if your levels are already at 4, another way of understanding how much radiation you're getting exposed to is that a family whose home has radon levels of 4 picocuries per liter is exposed to approximately 35 times as much radiation as the Nuclear Regulatory Commission would allow if that family was standing next to the fence of a radioactive waste site. That is huge. And a lot of people, I'm sure, have not even heard about radon being an issue or needing testing in the homes. So I put this slide on there mainly because to get a better understanding of the different levels and to drive home the fact that although the United States EPA does not recommend intervention until the levels reach 4, at a level of between 2 and 4, so if you look at the level 2, if 1,000 people who never smoked were exposed to this level over their lifetime, 4 out of those people could get lung cancer. That's the equivalent of the risk of dying from poison, which is not very high, but the interventions are not very difficult. And we highly recommend that if your levels are between 2 and 4, especially if you're a smoker, you should strongly consider doing some fixes around the house. And what might those look like? So there are certain things you can do to reduce radon levels in your home. And the first one of that is make it harder for radon to get in. Caulk and seal cracks in the basement, if there are cracks in the foundation or the subfloor. If you don't want to do it yourself, hire a contractor, have them do it. The other important thing is installing a good vapor barrier in the crawl space. So the goal there is to have a gas-tight barrier between the inside of your home and the ground underneath. And then ventilate. Simple thing as ensuring, well, one, ensuring that the foundation vent blocking is clear, And there is unobstructed venting from the home's crawl space. And then 2 is simple as increasing air exchange with the outside. When the weather is nicer, open those windows so that there is cross ventilation around the house. A home's radon levels often test higher in the winters when the homes are being heated, and in the summers when the air conditioning is on and the windows are all closed. Now, if you're like me and you don't want to do any of those things, find a radon mitigation professional through one of these national certifying organizations. Their numbers and their emails and their websites are listed on this slide. A radon mitigation system is installed by a certified radon mitigation specialist. There are none in Wenatchee when I did a quick Google search, but there are several in Spokane and Seattle who would travel and install the system that will then take away the work of caulking and sealing from you. So moving on from radon to the next item on the list, and that's asbestos. Asbestos is a compound that was widely used in the past as a thermal and acoustic insulation material. The microscopic fibers of asbestos can break loose from the material, released into the air, and from there, humans inhale it. And what happens when you inhale these is that they reach the little air sacs in the lungs, the alveoli, and they deposit in the tissues without decomposing. So once they're there, they're not going anywhere. They stay there forever. And that results in a lot of cell damage in the lungs. We don't see that cell damage until about 20 to 40 years after the asbestos exposure. And then we see not only lung diseases like asbestosis and inflammatory fibrosis kind of lung disease, but also a high risk of lung cancer and a cancer of the lining of the lung called malignant mesothelioma. Potential sources of asbestos in the home. So I put this slide here to drive home the fact that it was not uncommon to use asbestos in the homes, not just for insulation, but in several different places in the homes, especially before 1990s, okay? It's still present in many of our homes and in older buildings. The important thing though is that it's not usually considered harmful as long as it's not released into the air by deterioration or if you're doing demolitions or renovations on those buildings. So just because you live in an old home and you might have all these sources that are listed in that picture, that does not mean that you should be looking to move out of the home because of asbestos exposure. Then there are, of course, professions which have a high risk for asbestos exposure. And the highest risk professions are listed on this slide: military veterans, shipbuilding trades, asbestos mining, brake repair mechanics who work on older vehicles, construction and demolition workers who might be working on buildings that have asbestos used in the insulation, and then firefighters who are exposed to asbestos containing insulation with burning. So what can we do for exposure prevention? You know, as far as workplace prevention goes, there are very strict regulations under the Occupational Safety and Health Administration, or OSHA, as it's called, for what kind of personal protective equipment people are supposed to have on if they're working with asbestos. So what we'll focus on is what we can do around the home. So like I mentioned before, if the building materials in your home are not damaged and they're not being disturbed, you do not need to have your home tested for asbestos. So this is unlike radon. You don't need testing here. If you do need testing, don't test yourself. This is a place where you need to hire a trained and accredited asbestos professional for sample analysis. And this is especially important if you're looking into remodeling an old home or repairing an already damaged part of the house. All the repairs and removals in this case should be done by professionals. Again, a quick Google search to see what do we have available locally. It led to we have several asbestos professionals, both testers and contractors who will work on these buildings. And one of the numbers is listed here on the slide. Lethal combinations. I put this slide here to drive home the fact that while there is the risk, the individual risk of these exposures and cancers, there is also something called a combined risk. So if you look at the asbestos exposure, it increases your risk of having lung cancer by 6 times the normal. If you're a smoker, it increases the risk by 11 times the normal. Now, if you add the smoking and asbestos exposure together, look at that risk number. 59 times the risk of a normal person without any risk factors. So if you are exposed to asbestos, you have been exposed to asbestos in the past, especially important for you to refrain from smoking, or if you smoke, try your level best to quit smoking. Then there are some less common risk factors, such as there are other inhaled chemicals, mainly through different professions, such as arsenic, beryllium, chromium compounds, coal products, radioactive ores. And then there's arsenic in drinking water. That's not a problem in the United States. It's more of a problem in Southeast Asia and South America. Much less common problems here, though. This slide is interesting, and I put this here for a reason. You know, they did a number of these big studies looking for a potential role for vitamin supplements in reducing the lung cancer risk because of the antioxidants in them. And all of those trials had very disappointing results. What's interesting, though, is that 2 of those large studies that were looking at vitamins found that smokers who took beta-carotene supplements actually had an increased risk of lung cancer. So they don't know exactly why, but it's recommended based on those 2 very consistent findings from those 2 studies that smokers should not take beta-carotene supplements. Now, that does not apply to the fact that beta-carotene occurs naturally in a number of foods that are listed there on the picture on the left. That doesn't mean you should avoid dietary beta-carotene, but definitely don't take supplements if you're a smoker. Then there are unfortunately risk factors that you cannot change, okay, such as radiation to the chest. So if you've had a history of breast cancer or lymphoma and you had radiation in the past, it's going to increase your risk of lung cancer. Unfortunately, you cannot do much to mitigate or reduce that risk. Air pollution, researchers estimate that worldwide 5% of all deaths from lung cancer may be due to outdoor air pollution. And then there's personal or family history of lung cancer or genetics, right? Can't do anything about those darn genetics, but they do increase your risk for lung cancer. So the only thing you can do is if you already have a genetic or family history to mitigate the other risk factors, to make sure you don't smoke, make sure you test the radon levels, don't play with asbestos. So reduce the other risk factors that can be additive, that can add on to the risk. It says 5 causes on this slide, but I would say they're not really causes, but the risk factors. We talked about the big 3 ones: smoking, radon, asbestos exposure, air pollution, and genetics. So we're going to move on from there to symptoms. So how would you know that you need more testing? What are the common symptoms of lung cancer? So the symptoms of lung cancer, unfortunately, are very non-specific, especially when lung cancer is early. In very early lung cancer, it can be completely asymptomatic, which means you have no symptoms. When symptoms do start, they're often confused with, having common colds or having a chronic smoker's cough, for instance. They usually manifest with chest pain or shortness of breath, wheezing, or coughing. It's much later when cancer spreads to other parts of the body that you may start coughing blood or start having bone pains or headaches because cancer has spread to those organs in the body. And that's why, it's often known as the silent killer. If you look at the slide here on the right, it shows that 57% of lung cancer at the time of diagnosis has metastasized, which means that it has already spread outside of the lung to different organs in the body. 57%, that's more than half of all diagnosed cases still to this day. And that goes to show you how the symptoms are either so non-specific or symptoms are not present at all that allows the cancer to spread. And that's why we talk about the role of screening for lung cancer, which was not a thing until just recently, right? Why it makes sense to hunt for lung cancer. If lung cancer is found at an earlier stage, when it is small and before it has spread, the treatment is more likely to be successful. So on the left is a slide, on the left are the people at stage 1, on the right with stage 4, and you can see that if detected at stage 1, 75 out of 100 people will survive treatment for lung cancer. But if you're diagnosed at stage 4, your chances of survival are only 5 out of 100. So, and the previous slide showed us that what we're doing right now is we are mostly diagnosing at stage 4. So that survival is really, really poor, but there is something we can do to change that. Lung cancer screening is now recommended in people who have a history of smoking or who are still smoking, who don't have yet signs or symptoms of lung cancer, okay? And that allows us to detect lung cancer much quicker. It has been shown in the studies that led to the recommendation of lung cancer screening becoming formal is that low-dose CT scanning for lung cancer for high-risk patients it reduced the chance of dying from lung cancer by 20%. And that is huge. If you look at screening for other cancers, this number of the 20% reduction in the risk of dying is much higher compared to between 3 and 6% for other cancers. Despite these numbers, despite the data showing that there's such a huge reduction in mortality, there's so many more people we can save and diagnose early and have much better prognosis. This is the data from 2020. Only 5% of eligible individuals were screened for lung cancer in 2020, which points to an extremely high need for spreading this message of the need for lung cancer. Who are the people who qualify for lung cancer screening? So if you are a current or a former smoker who quit within the past 15 years, if you're between the ages of 50 and 80, those are the national recommendations. But for Medicare, the age cutoff is a little bit lower at 77. And if you have a 20-pack year smoking history. So what's a 20-pack year smoking history? It means that if it's the amount of the packs you've smoked multiplied by the years. So if you smoked a pack for 20 years, that's 20-pack years. If you smoked half a pack for 40 years, that's 20-pack years. So if you fall in that risk group, if you know someone, if you have a loved one, a relative who falls in those, who meets those criteria, it is extremely important for them to talk to their doctor about lung cancer screening CT. It says on this slide in the bottom, the verify coverage with your insurance, but here at Confluence Health, you don't have to do that. You reach out to us. We do all the work. We make sure it's covered by your insurance. Almost all insurances have buy-in. You just have to meet the criteria. We make sure you meet the criteria. You'll benefit from screening, and then you enroll in the screening program. Once you enroll, you get a CAT scan, a low-dose CAT scan once a year until the age of 77 for Medicare patients or 80 for all other patients. If we find abnormalities on the scan, then you can end up getting more frequent scans and possibly intervention or procedures as a result of those scans. But if there is one take-home message from the talk today, that's why I put this slide towards the end of the presentation, is that this is the 5-year survival rate for non-small cell lung cancer, which is the most common form of lung cancer right now. So the 5-year survival, if you're diagnosed as stage 1, and it doesn't matter for the purpose of this talk what stage 1A or 1B, but if you're diagnosed as stage 1, your survival is much higher. The numbers in the picture and what's in the text look a little bit different because they're from 2 different years. But the bottom line is that right now we are here. We are stage 4. This is where we're diagnosing most of our patients, and the survival there is between 1 to 2%. And what we really want to see is move more patients to the earlier stages where the survival is much better, between 50 and 54%. And screening for lung cancer, spreading the word about screening, approaching your providers about screening is the only way to get us there.
Thank you so much, Dr. Lodhi. That was so much information. That was really dense and wonderful. So thank you so much. Yeah, so much stood out to me. I'll ask the first question. The radon levels and just how much our homes affect us really stood out to me. And looking, so NCW Libraries service area spans 5 counties. And so looking at that map, Okanagan and Ferry counties in the north were in the red, and then Chelan County was the yellow, and Douglas, neighboring to the south, was orange. Is there any reason, or like what would be reasons why these neighboring counties have such vastly different levels of radon?
Yeah, the radon levels are really, it all depends on the geology of the area. It depends on, it's all produced by the amount of uranium. And, they test these levels and they generate these maps. But like I said, the concept of radon, the important thing is it wasn't a well-known factor in lung cancer risk until the early 2000s. So this is a relatively new discovery that people started noticing, well, why are so many non-smokers getting lung cancer? And now it's a very well-established association. So while the reasons are more geologic, not man-made as to why the radon levels differ, the important thing is that it really doesn't make you any safer if you're in a low radon area. The only way to know what your risk is to make sure you monitor those levels.
Okay, that's kind of leads to the second question I was going to ask, but you kind of answered was like when you're talking about these, what stood out at the beginning is this low survival rate, and you're like, wow, that's that's so discouraging. And then you see it's because people aren't screening for lung cancer, so it totally makes sense. And I was wondering if people in areas of higher radon should also be encouraged to do screening, not just the smoking, the history of smoking, but what you're saying is that that's not always
Yeah, so so again, screening for lung cancer is another thing that's a much newer concept. And I think
okay.
that is why there's not a lot of awareness about why it's important. I think sometimes there's also that taboo of the association with smoking, which really shouldn't be. For us as lung doctors, it really not is a reason to not come and get screened. The screening really was tested in the high risk population. So the benefit has been documented. You have to weigh the benefit and risk of it. And the benefit really has been documented in people who have that particular amount of smoking exposure. So they actually did a variable amount of testing, right, on lower levels of smoking, higher levels of smoking. And that was the group that stood out. So this was like very well-designed studies that went over several years to see, well, if we expose these guys, because getting a low dose CT is a very small amount of radiation, but it's still radiation you're getting exposed to as part of screening. So what is the risk benefit ratio? And this was a group that stands out as the group that will benefit the most from screening. I was looking at our institutional data from the past couple of years to see how many people are we capturing with the screening since our program went live in 2016. Only 15%. This is despite us trying to encourage people to get screening when they come to their appointments. Only about 15% are enrolled in screening. So this message really needs to get out that we can make a huge difference. The survival numbers are also a little bit behind. I should mention that too, is because in the past few years, we have now new therapies for lung cancer. So we have something called targeted therapy that targets the DNA. And then we have something called immunotherapy, which uses our own immune system to fight cancer. And that has changed the survival, even for some higher stages of lung cancer. And I think that will be reflected in data as time goes on. So we have the tools. I feel like we have more tools to help people now. Lung cancer, the diagnosis of lung cancer doesn't mean that is it. There's nothing we can do, nothing to do beyond that. So people should really reach out, try to reduce the risk, diagnosis early, and then kind of avail all these treatment options that we now have.
So Teresa asks, if there's radon or asbestos in a house, could that be because of the year that it was built in, for example? Could that affect the levels of exposure?
It definitely could, because, like I said in my slides earlier, radon enters usually through cracks in the foundation. So you can think about newer constructions are less likely to have damage to the foundation or pipe where the pipes are fitted and whatnot. So yes, radon exposure can be higher in older homes. And asbestos is now more regulated, so it's more commonly in the houses built before the 1990s. There's definitely a higher level of exposure. Again, important thing to remember though, don't be scared if your house is old. As long as the asbestos is not being disturbed, it's not going to cause you any trouble. It's only when if there are renovations going on in the house, that's when the fibers get exposed, or if something gets damaged. If you have a wall that's damaged, then yes, you are at risk of being exposed to the asbestos from insulation.
Another question from Karen. She's asking about wildfire smoke. Just, here in North Central Washington, we've had such a history of horrible fires. How can that affect?
So wildfire smoke has not directly been linked to a high risk of lung cancer. There is some data that you can extrapolate from looking at environmental pollution, right? So now we are really extrapolating, which means that the particles that cause air pollution, so they're like these little tiny particles of a certain size that can be inhaled into the lungs and can really lodge deep into the lungs. So if you take that data, the same data can be applied to wildfire smoke, the same particulate matter, which is a size 2.5 little particles, they get very, very high. So when we get reported the air quality index and is really poor, that's the particle size they're measuring in the air to see why the air quality is bad. So you can think about it that way. I showed a slide where I said environmental or air pollution has been linked to a 5% increase of risk in lung cancer. So similarly, in areas like ours, where we now have not just a week or two, but months of exposure to poor air quality, can that over time increase the risk of lung cancer? Theoretically, yes. Is there any data on it? No. There's no data on it because it's very hard to measure levels of exposure, which are so variable, and then follow those people, like the number of people over time. But theoretically, yes, it could have a link to increased risk of lung cancer.
Okay, interesting. We're becoming researchers tonight. Well, it looks like those are last call for questions. These were really good questions. So thank you, participants, for the learning continues, but it looks like that might be all of them.
So for people who are on the talk, though, I just want, since we don't have any more questions, I have a question. What made you guys interested in logging on to today's talk? And is there something else you would be interested in us reaching out to the community from a lung health standpoint? I would like to know if somebody's willing to share.
Yeah, that's a great question. I would love to hear if our attendees have an answer on that, because yeah, what I'm really hearing loud and clear from you is that there's such a gap in knowledge around lung cancer, and that really finding a way to get the message out there could really improve our rates.
Or is there another way the community would like to hear the message rather than a talk to the library? Like, well, if you guys have suggestions, we would love to hear that. We would love to hear all of those. Yes.
Yeah, so one of our attendees shared that her aunt passed away due to lung cancer with no history of smoking, and was just really shocked by that news. So yeah, sorry for your loss.
Yeah.
I'm glad you're being proactive to find information. Sorry, Dr.
Like
Lodhi.
I said, it's important to look at all the risk factors, especially when lung cancer occurs in non-smokers. There could be people residing in the same house still. And it is important to, like I said, radon is one of the top ones to test for. If they're local, contact the Washington State Health Department. Most of the state health departments will mail you kits for testing the home.
Yeah, I looked up I'll put in the little chat the link from the Department of Health about radon. Karen was saying, very informative, didn't know the risk factors until now. And I agree with you, Karen. I'm like, I learned so much tonight. So yeah, I think you're doing really good and important work, Dr. Lodhi, just getting out there and educating. And, it's just a ripple effect to share the knowledge with this group, and then they'll share it with their family and friends. So
it was my pleasure.
And I'll just give a quick little commercial. This program is every Wednesday. And so we're going to have another program next Wednesday evening, which is going to be May 25th at 7 p.m. same time. And this is going to be Save Your Rack, Prevention and Treatment of Breast Cancer with Dr. Catherine Straub and Dr. Julie Smith. And we're going to be talking about mammographies and image modalities and lots more interesting information about how we can take better care of our health and preventative medicine. So you can find out more on our website at ncwlibraries.org or follow us on Facebook at NCW Libraries. And yeah, another message saying thank you so much. The participants really enjoyed this talk. So Dr. Lodhi, thank you so much for your time. It was very informative.
You guys are welcome. Thank you for having me.